I'm Dr. Sloan. I am the physiatrist here at Steamboat Orthopaedic and Spine Institute. And what that means is I take care of low back pain with medications, rehab, and injections, and trying to see if we can't avoid surgery. I've been doing this for over 10 years, doing injections and procedures in the lumbar spine. I've been here in Colorado for over 3 years now, and before that, I was in New Mexico in my home state, doing procedures for over 9 years. So patients may wonder who should come and see us here at Steamboat Orthopaedic and see our team for their back pain. But basically back pain, leg pain, or pain that radiates down the arms or legs that has been going on more than a few weeks and not getting better, certainly are more than welcome to come and see us, and we'd be happy to evaluate your pain. Of course, also seeing your primary care doctor can help out, and they can get the ball rolling on a few things. But our goals when you come to see us is to evaluate your pain and get the right diagnosis. Usually we'll do that with imaging and some examination. But really our goal is to allow the patient to really understand their diagnosis. What does it mean? And what to expect from the treatments and moving forward, and how we can help out with their pain. So we'll take images, help make sure the patient understand their images, make sure they understand what exactly is going on, what the procedure means, and why am I doing it, and what I expect from it. I find that the patient who understands their treatment usually does pretty well. So that's going to be our goal here with our interventional spine team at SOSI. So some of the most common treatments that we do is we treat low back pain with injections, typically with an epidural steroid injection, or sometimes with medial branch blocks or with nerve ablations. But there are a whole host of different procedures that we do here to try to help out with your aches and pains. I'm also fluent in Spanish, so nosotros hablamos español aquí. Estamos listos para ayudarte para sus dolores en la espalda. So sometimes patients have questions whether they should do surgery or do some of these procedures, and those are all very legitimate questions. And some patients do need to jump to surgery, but most of the time they do not. A lot of patients will say, well, I don't want a Band-Aid to fix my back, and the truth is what we're doing is not Band-Aids. It can actually help with the rehab of the back and actually correct the issue. And so what I tell a lot of patients is sometimes we can correct your back pain with some rehab or a couple of needles instead of a few scalpels and stitches. So a lot of times we're able to do that. Of course, we're able to evaluate and see if you do need to skip over those and go and see the surgeon. So the injections or procedures that we do in the spine, basically they're X-ray guided injections, because when we go to the spine, a lot of times we're looking at very, very small targets where nerve runs or where joints are. And so we use an X-ray machine that moves, twists, turns every which way that we ask it to, and can actually take live imaging using X-ray, so I can actually see things occurring in your back through the X-ray. And that allows me to get the injection into the precise spot and make sure that the medication is only going where I want it to and nowhere that I don't. And what these injections do, depending on the problem, can help alleviate pain and inflammation, but can also help jumpstart the process of healing in the back, especially as we do rehab in the back and certain types of therapy to allow different things to heal and resolve. And sometimes we can get years relief or more from these different types of procedures. So if you want to come see us over at Steamboat Orthopaedics, you can go ahead and give us our office a call and set up an appointment, or you can get a hold of your primary care physician and they can evaluate you and send over a referral.